morning. I'm Sean Maroney.
And I'm Sharon Tazwell. Thanks for joining us tonight. We'll get to your forecast coming up here in just a moment. But first, a story you'll only see on CBS North Carolina. They're supposed to be some of the cleanest places you ever go. But a former employee says one of the largest hospitals in our area is putting some patients in dirty beds.
Beds with dried blood, even vomit on them. CBS North Carolina investigates Jonathan Rodriguez took the issue straight to WakeMed to find out what's going on.
I noticed the blood on the stretchers was obviously not from that patient.
We have found that it is a common problem. We've reached out to other hospitals and other systems, and it is an issue.
This is absolutely a health risk.
We're not perfect yet. We are striving for it. We are going to get there.
And this was such an obvious problem and should have been such a simple problem to fix. These are all just nominations from doctors and the patient care advocates and fellow nurses. And this is the Daisy Award.
Jeff Johnson says nursing is a passion, not just a job.
And these are all just notes for being a team player from my boss within the last 6 months before all this started happening.
But he's left his position at WakeMed Hospital in Raleigh.
The crew is fantastic. They got some of the best doctors here. I've actually had surgery here that I chose the doctors here. They're being told that this problem is taken care of.
The problem? Johnson says patients are getting put into beds like these.
I just started taking pictures, 12 to 20 pictures every single night. I worked for 3 months.
He gave CBS North Carolina more than 100 photos.
It was getting to be 50% of the stretchers at least. A lot of blood spots, a lot of blood drips. And some areas where vomit had went down the side of the stretchers, and it was just covered up with a clean sheet.
We went straight to the hospital for answers.
The pictures are pretty gross, and he says patients are being placed in these beds. How did that happen?
Well, to our knowledge, patients have not been placed in those beds. Interestingly enough, we've known about some of these issues at least since 2015, and we've had a task force working on this.
Dr. Wes Paul oversees quality operations at WakeMed.
I can't say that it absolutely didn't happen, but if it did, as soon as we found out, that would be taken care of and taken care of relatively quickly.
Blood on the stretchers, blood dripping down the stretchers. That's all blood.
Based on the pictures, most of the blood spots are on parts of the bed that aren't necessarily in plain sight. But Johnson said he'd often catch it after a patient was already placed in the bed.
And it's embarrassing to tell them, hey, can you get up, the bed's dirty? You kind of do what you can to switch things out without embarrassing yourself in the hospital.
We have implemented several systems, actually even before and during this employee's tenure, that actually terminally cleans the beds and checks at least 3 times between each patient to make sure they are appropriately cleaned.
Dr. Paul says once a month each bed is taken apart and thoroughly washed. They're then tagged to let nurses know they've had that cleaning.
These tags are just to make sure we terminally clean them on a routine basis, not that they are clean at the time.
I couldn't believe it. Who cares if they were cleaned if they're not clean to put a patient in right now?
Yes. Can there be defects in that? Yes. But when they are caught, again, we immediately pay attention to those and we clean them before patients are put in.
He says Johnson did the right thing by bringing the issue up, but also should have been part of the solution.
Just figured it was an easy fix and went to my boss and then the higher-up boss, and nothing was getting done.
It is also that employee's responsibility. When they identify the issue, the first thing they do is fix it themselves. It's an individual responsibility.
Whether it's in the ER or the OR, these beds are going to be exposed to blood and other fluids. After all, this is a hospital. And while they don't see eye to eye on how the issue is being addressed, both parties agree that cleanliness has to be a priority.
That's what I'm in this profession for, is to try to do the best I can for people.
Can you assure patients when they're coming in that they're not going to get placed in a bed that's covered in blood and vomit?
Yes, we can. But again, perfection, I wish it was attainable. If there is, and there is an issue, and we identify it, or the patient identifies it, immediately it'll be fixed. But yes, I'm confident that they will not be placed in a bed with blood or vomit or any other bodily fluid.
Dr. Paul says while the bed should be clean, one of the things they use to monitor issues like this are infection rates, which he said has not been impacted by this issue. Now, while we were looking for any type of outside agency that may inspect this kind of thing, we came across a survey reported by a federal health department that asked patients about cleanliness. It didn't ask about beds specifically, but it did ask about their rooms and their bathrooms. So we looked at some of the hospitals in our area. You can take a look at the numbers there. The percentage of patients who reported that their room and bathroom were always clean at UNC, it was 71%, 67% at Duke, 64% at Rex, and WakeMed was at 62%. The national average, by the way, is 74%. Sean?
All right, Jonathan, thank you. And if you have an issue you want our CBS North Carolina Investigates team to check out, email us at investigates@wncn.com. Now,